Hey, Happy New Year, everybody. Thank you so much for taking time out today after the holiday to join us today. We really appreciate it. For years, as you know, my office has been working to combat the opioid epidemic that has devastated Washington families and overburdened our healthcare system. My team has put in considerable time and resources into this effort. We've initiated investigations. We've filed lawsuits. We've convened summits. We proposed legislation and advocated for reforms at the state and at the federal level. Here's why. Between 1997 and 2011, prescriptions and sales of opioids in Washington skyrocketed more than 500%. To put that in some perspective, in 2011, just give you one data point, 2011, there were enough opioids prescribed in Washington state for every man, woman, and child, so we're including my 11-year-old twins, to have a 16-day supply for every man, woman, and child. As recently as 10 years ago, there were 16 counties in Washington state in which there were more opioid prescriptions that year than there were people. More prescriptions than people, not pills, more prescriptions than people. In 2015, there were still 8 counties where there were more prescriptions than the population. Between 2006 and 2017, in that decade, opioid overdoses killed more than 8,000 Washingtonians. More than were killed by car accidents or firearms. The majority of drug overdose deaths in Washington state involve opioids. The epidemic has strained Washington's healthcare system. Between 2009 and 2014, the rate of opioid-related hospital and clinic stays increased by more than 60% in Washington. And of course, the human toll is staggering. Opioids are devastating families, and my legal team is on the front lines. A 2018 internal survey of the folks in my office, Washington State AAG's Assistant Attorneys General, who handle child abuse and neglect cases all across our state. They're in courtrooms advocating for children when there's an abuse or neglect in the home. We asked them, what role has opioids played? What percentage of cases do opioids play a key role in those cases where there's abuse or neglect? And the legal team came back and said in approximately half of those cases, opioids played a key contributing factor to why a child had to be separated for a period of time or permanently from the home. We're here today to announce the next major step in our effort to hold accountable those who are responsible for this epidemic. This morning, we filed a lawsuit against opioids manufacturer Johnson & Johnson in King County Superior Court. It's not the first lawsuit that we have filed. In 2017, we were one of the first states to file a lawsuit against Purdue Pharmaceutical. In March of last year, we sued the 3 largest distributors of opioids, McKesson, Cardinal Health, and AmerisourceBergen. These are Fortune 15 companies. We have a trial date scheduled for those 3 entities coming up in October of this year. So the team that has joined me today has not only filed this case today, but is also preparing for a trial in October of this year against those 3 entities. Like other companies that sold and distributed opioids, Johnson & Johnson made billions of dollars by fueling Washington's opioid epidemic. Like others, they knowingly deceived doctors and the public about their products' effectiveness in treating long-term pain and the incredible addiction risks of long-term opioid use. But the story of the harm Johnson & Johnson inflicted on Washington state is different in an important way. Johnson & Johnson was also one of the most prolific suppliers of the raw materials used by countless other companies to actually make opioids. Much of the vast expansion of prescription opioids from the industry as a whole can be traced back to Johnson & Johnson. Today I'm joined by State Representative Lauren Davis from the Shoreline area, the 32nd District, who is also the Executive Director of the Washington Recovery Alliance. You'll be hearing from her shortly. We're also joined by Debbie Warfield of Everett, and also by Skagit County Commissioner Lisa Janicki. Both of those women will be speaking as well and sharing a personal perspective of the opioid epidemic and how that's impacted them on a personal level. And I'm also joined by a large number of folks from my legal team who may be assisting me in answering questions as well. So I'll say a few words, then Commissioner Janicki will speak, followed by Representative Lauren Davis, followed by Debbie, and then we'll take your questions. My guess is that when Washingtonians, most Washingtonians, think of Johnson & Johnson, they probably think of baby shampoo. In fact, Johnson & Johnson played a unique role in proliferating opioids in Washington and around the United States. Starting in the 1990s, Johnson & Johnson and its subsidiaries cultivated and processed opium poppy plants and used their raw narcotic materials to manufacture the active ingredients necessary to produce opioid drugs. Johnson & Johnson even developed a poppy plant strain known as the Norman poppy that was high in thebaine, the raw ingredient needed to produce many opioid drugs, including oxycodone. In internal documents, Johnson & Johnson called the Norman poppy, quote, a transformational technology that enabled the growth of oxycodone, end quote. One Johnson & Johnson subsidiary in Tasmania cultivated and processed the opium poppy plants into the necessary narcotic raw materials. Another subsidiary imported them in the United States and then processed the raw materials into the active pharmaceutical ingredients necessary to manufacture opioids. Johnson & Johnson used these ingredients to make its own opioid drugs. In addition, they sold those raw materials to other companies like Purdue Pharmaceutical, and that was a major part of its business. By 2015, Johnson & Johnson was the top United States supplier of the active pharmaceutical ingredients used to make opioid drugs. Johnson & Johnson's raw ingredients went on to become oxycodone, hydrocodone, fentanyl, and others. In addition to its role as a major supplier of the raw ingredients used to make opioids, Johnson & Johnson also deceived doctors and patients about these opioids. Johnson & Johnson aggressively marketed its opioids for chronic pain conditions like headaches and back pain, despite evidence that opioids were not effective at treating these conditions. Johnson & Johnson used both branded marketing and non-branded sources funded by the company to forward its narrative. These non-branded sources included third-party organizations funded by Johnson & Johnson and other manufacturers, like the American Pain Foundation and the American Academy of Pain Management, among others. Those efforts included articles in medical journals and publications funded by Johnson & Johnson, continuing medical education, dinners, seminars, symposiums, conferences, all paid for by Johnson & Johnson and others. The third-party groups also funded lobbying efforts to oppose state-level regulation of opioids, including here in Washington State. For example, the American Pain Foundation provided support to the Washington Pain Alliance to oppose opioid prescription standards here in Washington State. The Centers for Disease Control and Prevention determined in 2016 that, in fact, no study exists to show opioids are effective for long-term pain treatment. And the CDC found, quote, extensive evidence that those who use opioids for more than 3 months are at a substantially increased risk of opioid use disorder. Further, other safer options are effective and carry fewer risks, the CDC added. Despite the evidence, Johnson & Johnson claimed there is a very low risk that patients will become addicted to its opioids. For example, Johnson & Johnson marketed one of its opioid painkillers as, quote, a less addictive, milder opioid. At the same time, the FDA-approved label for the drug clearly stated that it had, quote, a high potential for abuse. Like others, Johnson & Johnson even pushed the false narrative of something called pseudo-addiction to persuade doctors that what appeared to be addiction in patients who came back looking for more pills was actually under treatment of their pain. So individuals would come back wanting more opioids, and what Johnson & Johnson said in response to doctors saying, hey, you said this stuff wasn't so addictive. Why are these folks back in my office looking for more pills? They coined a term, pseudo-addiction. Those folks aren't really suffering from addiction despite the way it looks. They're actually in pain. And you only get one guess what they recommended those doctors do to treat that pain, more pills. Pseudo-addiction was in fact coined by a doctor who later became an executive at Purdue Pharmaceutical. No study has validated the theory of pseudo-addiction. Here's what we're seeking with this litigation. In addition to civil penalties and damages, we are asking the court to order Johnson & Johnson to give up the profits it made in Washington State as a result of its illegal conduct. Johnson & Johnson has made billions of dollars through its sale of opioids and the raw materials it sold to other companies. We expect Washington's share to at least be in the millions. In November, to put this case in some context, an Oklahoma judge ordered Johnson & Johnson to pay the state $465 million for its role in fueling Oklahoma's opioid epidemic. Our goal is to use the surrendered profits to remediate the effects of the opioid epidemic. The goal, for example, is to fund treatment, education, prevention in communities all across the state. The bottom line is that Johnson & Johnson, like others, must be held accountable for the harm that they've caused to Washington State and to Washington State families.